Hello farmers, welcome to episode 5 of the series on factors affecting egg production in the egg-laying poultry business. If you didn't watch episodes 1, 2, 3, and 4, the links to the videos are in the description below. Today we will be talking about diseases. Foul pox. Foul pox is a viral disease of chickens characterized by scab-like lesions on the skin of the unfeathered body parts and/or on diphtheritic, wet, membranes lining the mouth or air passages. Infection with the foul pox virus will cause the chickens to have poor growth, poor feed conversion and a precipitous fall in egg production. Foul pox may affect any age bird. It is transmitted by direct contact with an infected chicken or by mosquitoes. Coccidiosis. Coccidiosis is a protozoan disease characterized by enterithes and diarrhea in poultry. Unlike the organisms which cause many other poultry diseases, coccidia are almost universally found wherever chickens are raised. Coccidiosis outbreaks vary from very mild to severe infections. Individual strains of cocci attack birds differently, resulting in diverse symptoms. The overall symptoms may be one or more of the following: bloody droppings, high mortality, general droopiness, emaciation, a marked drop in feed consumption, diarrhea, and a drop in egg production in layers. It is common to add a coccidia state in the feed of broilers. In addition, live vaccines are currently available. Infectious bronchitis. Infectious bronchitis is a highly contagious respiratory disease. The disease is caused by a virus which is moderately resistant, but can be destroyed by many common disinfectants. Infectious bronchitis occurs only in chickens. Infectious bronchitis is different from quail bronchitis, which affects bobwhite quail. All ages of chickens are susceptible to infectious bronchitis. In laying hens it is characterized by respiratory signs, gasping, sneezing, coughing, and a marked decrease in egg production. Egg quality is also adversely affected. Low egg quality and shell irregularities, soft-shelled or misshapen, may persist long after an outbreak. Chickens that have had infectious bronchitis, especially during the first week of life, may never be good layers. There is no effective treatment for infectious bronchitis, although broad-spectrum antibiotics for 3 to 5 days may aid in controlling secondary bacterial infections. Vaccines can be used for prevention, but they are only effective if they contain the right serotypes of virus for a given area. Infectious bronchitis vaccine is often combined with Newcastle vaccine in the same vial. Newcastle disease. Newcastle disease is caused by a virus. The viruses vary in pathogenicity and are classified as lentogenic, mildly virulent, mesogenic, moderately virulent, and velogenic, markedly virulent. Newcastle disease is characterized by a sudden onset and rapid spread through the flock. In adult laying hens, clinical signs can include depression, loss of appetite, decreased water consumption, and a dramatic decline in egg production. Production may drop to zero. Newcastle disease runs its course in 10 to 14 days, but the hens do not come back into full production for 5 to 6 weeks. There is no treatment for Newcastle disease. Antibiotics can be given for 3 to 5 days to prevent secondary bacterial infections. Chickens and turkeys can be immunized against Newcastle disease by vaccination. Avian influenza. Avian influenza is a viral disease affecting the respiratory, digestive, and/or nervous systems of many species of birds. Avian influenza viruses are classified based on severity of disease, ranging from apathogenic to highly pathogenic. The mildly pathogenic form produces listlessness, respiratory signs, sneezing, coughing, and diarrhea. The level of mortality is usually low. The highly pathogenic form of avian influenza produces facial swelling, cyanosis, and dehydration with respiratory distress. Dark red/white spots, cyanosis/ischemia, develop on the legs and combs of chicks. Mortality can range from low to near 100%. The decrease in egg production is related to the severity of the disease and can be severe. There is no specific treatment for avian influenza. Recovery is rather spontaneous. Birds slaughtered 7 days after infection often have no significant increase in condemnations. Avian encephalomyelitis. Avian encephalomyelitis, epidemic tremors, is a viral disease usually affecting young poultry. It is characterized by incoordination and tremors, especially of the head and neck in chicks, and elevated mortality levels. Chicks that recover may later develop cataracts after sexual maturity. In affected hens, decreases in egg production and hatchability are noted. Laying hens seldom show clinical signs when infection is going through the flock. However, good production records often reveal a slight drop in egg production, 5 to 20%, lasting no more than 2 weeks. In breeding flocks, a corresponding decrease in hatchability is also noted. There is no effective treatment. All replacement breeder and layer pullets should be immunized. Mycoplasma gallisepticum infection. Mycoplasma gallisepticum infection, chronic respiratory disease, PPLO infection, air saculitis. MG, is characterized by respiratory distress, coughing, sneezing, snicks, rales, discharge from eyes and nose, feed consumption and egg production decline in laying hens. Mortality is usually low, but there may be many unthrifty birds. The organism may be present in a flock and cause no disease until triggered by stress, e.g. changes in housing, management, nutrition, or weather. Many broad-spectrum antibiotics have been used for treatment and will suppress losses. However, relapses often occur when treatment is discontinued. Most antibiotics are given in feed or water, preferably in water. Thylacinate and tetracyclines have been used extensively for treatment. Injectable antibiotics may be more effective if the disease is advanced and if the flock is small enough to be treated individually. FDA withdrawal periods for respective medications used must be strictly observed to avoid residual chemicals in the eggs and meat. Live and inactivated vaccines also are commonly used to reduce the adverse effects of the disease. Foul cholera. Foul cholera is an infectious bacterial disease of poultry. With an acute outbreak, sudden unexpected deaths occur in the flock. Laying hens may be found dead on the nest. Sick birds show anorexia, depression, cyanosis, rales, discharge from eyes and nose, white watery or green mucoid diarrhea, and egg production is decreased. As foul cholera becomes chronic, chickens develop abscessed wattles and swelling of joints and foot pads. Cheesy pus may accumulate in the sinuses under the eyes. Flocks can be treated with a sulfa drug. Sulfa drugs are not FDA approved for use in pullets older than 14 weeks or for commercial laying hens. Sulfa drugs cause residues in meat and eggs. Prolonged use of sulfa drugs is toxic and causes a decrease in production in laying hens. Antibiotics can be used, but require higher levels and longer medication to stop the outbreak. Where foul cholera is endemic, live and/or inactivated vaccines are recommended. Do not start vaccinating for foul cholera until it becomes a problem on the farm and a diagnosis is confirmed. Infectious coryza. Coryza is a respiratory disease of chickens. Common clinical signs include swelling and puffiness around the face and wattles, a thick sticky discharge with a characteristic offensive odor from the nostrils, labored breathing, and rales. There is a drop in feed and water consumption as well as egg production. Sulfadimethoxine, Alban, is the preferred treatment for infectious coryza. If albenfalzar is not available, sulfamethazine, sulfamorazine, or erythromycin, gallamycin, can be used as alternative treatments. The sulfa drugs are not FDA approved for pullets older than 14 weeks or for commercial laying hens. A vaccine for infectious coryza is available. It is given subcutaneously, under the skin, on the back of the neck. Chicks are usually vaccinated 4 times, starting at 5 weeks of age, i.e., at 5, 9, 15, and 19 weeks with at least 4 weeks between injections. Vaccinate again at 10 months of age and twice yearly thereafter. Other problems to consider. There are a variety of other problems which can cause an apparent drop in egg production. They include predators and snakes consuming the eggs, egg eating by hens in the flock, excessive egg breakage, hens which are able to run free hiding the eggs instead of laying in nests. That's all that we have for you today. For more future videos, kindly click the subscribe button. You can also click the links on the description below to visit our website and to watch other farming videos. Thank you for watching.